All right, so now we're going to talk about medication safety. And one of the things we're going to talk about is controlled substances. If you're giving controlled substances, you need to make sure that you're following procedures for sign out and wastage. That is a legal requirement that protects you from accusations or suspicion that you're diverting medications. When people are in a hurry, I hear it quite frequently, they will just ask someone to sign their waste. I want to caution you against signing waste without watching it, because when someone is caught diverting meds, it is very, very frequently not who you would expect. You need to at least know what the pregnancy risk categories mean. A means it's expected to be safe. X means absolutely not. There are varying levels of safety in between. So you need to know how to look up pregnancy category if your client is pregnant. You need to know the medication you are giving. And this is one thing that I really, really want to emphasize. Anytime you are learning about meds in school, anytime you are learning about meds as a practicing nurse, I don't want you to memorize a list of indications and side effects. What I want you to do is look at the mechanism of action. What does this drug actually do in the body? Based on that, you can figure out why it would work for the conditions you're giving it for. You can figure out most of the side effects or adverse effects. Okay, you can figure out what it might interact with. So you need to know those things. You need to know the contraindications and precautions, but a lot of those things are actually intuitive once you understand the mechanism of action. So when you get out your drug book, which mine is not up here, maybe it's in my clinical bag. You get out your drug book, I want you to look at the mechanism of action, and I want you to think about the physiologic action. What does that drug do in the body more than chemical reactions? So an example would be enalapril. So what class of drugs is enalapril, and what does that class of drugs do in the body? You can also find that information in your pharmacology book. It's not going to be by individual drugs, it's going to be by class. So let's look in the pharmacology book. Since I don't have my drug book. And let's see, 525 in this edition. Okay, we know it's an antihypertensive, but what type of antihypertensive is it? Okay, enalapril is a calcium channel blocker, if I'm not mistaken. Enalapril is a calcium channel blocker. So how do calcium channel blockers actually decrease blood pressure? Okay, do they work by removing fluid? Do they work by vasodilation? What do they do? That's going to help you determine what the side effects are. Calcium channel blockers cause vasodilation, which means when your patient is sitting and they stand up, they're not going to vasoconstrict to keep all the blood in their head. They're going to stay vasodilated and they're going to get dizzy and fall back down. So one of the most common side effects that we see with a lot of blood pressure meds, but especially the ones that vasodilate, one of the most common side effects that we see is going to be, I get dizzy or lightheaded when I stand up, or I've had 3 falls. So we can then teach our patient how to avoid those falls with their blood pressure meds. So study meds by the mechanism of action. Okay, the 5 rights. When you're actually administering medications, you need to give the right drug in the right dose to the right patient at the right time by the right route. There have been additions to this. There's the 6 rights and the 5+5 and all those things. Go back to the basic 5 rights. Okay, am I giving the right drug? Am I giving the right amount of that drug? Am I giving that drug to the right person? Am I giving it at the right time? Am I giving it by the right route? Okay. For error prevention, if we want to prevent med errors, it's better to set up systems to prevent error than it is to punish individuals who make errors, okay? Because you give a lot of meds as a nurse, you're going to make med errors. So what can you do? What systems can you set up? Ideally, your facility has systems set up to prevent errors. But you can also set up your system to prevent errors. One thing I would never do if I'm in a facility where I don't have the capability of scanning at the bedside, I would never have more than one patient's meds pulled at the same time. If I've only got one patient's meds, I can't mix them up. Okay, I would have one patient's meds pulled at a time and take them to that room. That's one of the things that I would do. The most common med errors are giving the wrong medication or an IV fluid. So what could cause that? We could have meds that look alike or sound alike, or their packaging looks alike. Sometimes patients maybe go to surgery and they come back and their fluid order changed and nobody really paid attention that it wasn't the same fluid. So they just keep hanging the wrong fluid. So check fluid orders, check your IV fluid at the beginning of the shift. I've been told a patient was on normal saline and gone in the room to find D5 half hanging. Those are not the same fluid. So make sure you're checking your fluids. For look-alike, sound-alike meds, you want to take the time to read them for one, but also some manufacturers have started putting alerts, but some things just shouldn't be stored with other meds. In most facilities, IV potassium is mixed in the pharmacy, and so it's delivered to the nursing unit as an IV bag with big red potassium on it, right? In some facilities and on some units, nurses might be in the position of having to mix their own potassium into an IV fluid. And I've been on units where we had to do that before. So if the potassium is stored in the patient's med drawer along with everything else, something you should know if you've never seen a vial of potassium is potassium's distributed in 10 milliliter vials with a white label with a light green cap. Does that sound familiar to anything else that ends in chloride? So at one time I was at a facility and this was a very long time ago, and this is no longer the case at that facility, but at one time I was at a facility and they didn't have pre-prepared flushes. And so nurses used syringe and needle to drop their saline flushes. So there were vials of normal saline in the patient's med drawer. They also had individual med drawers for the patient. And they also mixed their own IVs. So if an IV needed potassium, then there would be a vial of potassium in the same med drawer with the very similar looking vial of normal saline. The difference would be the red print. But if you're in a hurry and you grab that up and you are not looking at the right side of it, it's really, really easy to flush an IV with that potassium, okay? So should we be checking that vial carefully every time? Yes. When you've got 7 patients and 3 need pain meds and 1 wants a discharge and you've got an admit coming and this one keeps getting out of bed and setting off the bed alarm, how many times do you glance at things quickly and just hurry up and get done? That's why potassium, if it's on the unit at all, should be stored in a completely separate location that has to be accessed intentionally. So you cannot accidentally pull out potassium and flush an IV with it. That's an example of setting up systems that prevent med errors. Another common med error is the incorrect dose or route. Make sure that you question unusual doses or rate, dose or rate. Make sure you question unusual doses and rates. Question whether that's really what needs to be done. The wrong client, wrong route, or wrong time are there. Another common error is allergy, administering a med that the patient is allergic to. EHR is helpful with this because it'll alert and say, hey, this patient's allergic. Don't count on that. We need systems that prompt us to check for allergies every time. Omissions or extra doses. Sometimes this has to do with documentation. If a dose is given but not documented, someone else may come behind and think it hasn't been given and give another dose. Or if a dose is documented and then the nurse gets called away before that med is given, then someone may not give that med thinking it's already been given. So be careful with documentation. In the moment documentation is the safest. Incorrect discontinuation, meds that should be continued being discontinued, or meds that should be discontinued, continue on for days and days. An inaccurate prescription. You really need to know the appropriate meds and doses for your patient population. If you don't yet know that, you need to be looking them up, and that takes more time, but you've got to be looking that up and know what you're giving. You should always question unusual prescriptions. Sometimes you learn something new. Sometimes that unusual prescription is appropriate. Sometimes you prevent a med error. The procedure for a med error: if you commit or if you find a medication error, the very first thing that should be done is assess the patient. You need to assess the patient for harm. You need to report that error to the provider ASAP. Document the facts in the chart. Do not state med error was made. If the patient does not have an order for diphenhydramine and you give diphenhydramine, you just state in the chart, in the nurse's notes, diphenhydramine 12.5 milligrams given by whatever route. Okay, don't say it was an error, just state that it was given so that it's documented. For legal purposes, you don't want to call attention to an error, but you also don't want to hide an error. You also want to complete an occurrence report, or you must complete an occurrence report, and you need to report to the immediate supervisor according to facility policy. And if it's a serious risk, you always want to report that ASAP. If it's a lower risk error, then that might wait till business hours. Okay, we're going to come back in the next recording and talk about home safety.